I want you to do something right now. Swallow once, just once, and pay attention to what you feel at the back of your throat. Is there something sitting there? A thickness? A coating that simply will not clear no matter how many times you have tried this morning? Now I want you to sit with that question. You have probably been clearing your throat dozens of times every single day. And if I asked you exactly when it started, you likely could not give me a precise answer. It did not announce itself. It crept in slowly, quietly, the way most serious patterns do. First, it was just mornings. Then it was the whole day. And now it has simply become part of your existence. You carry water everywhere you go. You avoid certain foods without fully understanding why. You have tried every remedy your neighbors, your relatives, and the internet could offer. And yet here you are. Here is what I need you to hear, and I need you to hear it clearly. That mucus is not random. It is not simply your age settling in on you like an uninvited guest. Your body does not operate randomly. Every persistent symptom is your body communicating something specific, sending a message through a channel most people never learn to read. The question is whether you have the knowledge to understand what it is saying. Today, I am going to give you that knowledge. Because in my years working in preventive health and senior wellness, I have seen this symptom, persistent throat mucus, misunderstood and mismanaged more consistently than almost any other complaint in this age group. People are handed lozenges. They are told to drink more water. They are sent home. And the actual root cause, sitting quietly underneath all of it, never gets addressed. That ends today. I am going to walk you through 5 specific research-supported causes of persistent throat mucus in adults over 55. And I am going to do something that most discussions of this topic never bother to do. I am going to tell you which 2 of these causes are almost certainly working together in your body right now. Because in my clinical experience, they almost always do. And I am going to explain how that combination makes everything dramatically and unnecessarily worse. My name is Dr. Adewale Morgan. I work in preventive health and senior wellness. My commitment to this community is always the same: plain language, real research, and practical steps you can begin implementing tonight. Before we go any further, drop a comment below and tell me this. Is your throat mucus worse first thing in the morning? Or does it stay with you throughout the entire day? Your answer to that single question tells me quite a lot about what is driving this in your body. Write morning or all day in the comments. I read everyone, and I take them seriously. Now let us get into it. Starting with the piece of biology most people have never been told. The piece that changes everything about how you understand this problem. Your body produces mucus every single day, non-stop, around the clock. And that is completely normal and entirely healthy. Mucus is your body's protective coating for your airways. It captures bacteria, dust, and viruses before they can settle deeper into your lungs. It keeps the delicate tissue lining your throat moist and resilient. Without mucus, your airways would dry out, crack, and become vulnerable to every pathogen you encounter. Mucus is not your enemy. The problem is what happens to that mucus as we get older. Here is something research has confirmed clearly, but that most people are never told by their physicians. There is a system in your body called mucociliary clearance. Your airways are lined with millions of microscopic hair-like structures called cilia. Their job, executed millions of times each day without your awareness, is to sweep mucus upward and outward, keeping it thin and mobile so it never pools. In a younger adult, this system is efficient and fast, but studies confirm that as we age, these cilia slow down. They beat less frequently, and the result is that mucus, which would have been swept clear in seconds at age 40, can pool and accumulate for hours at age 65 or 70. Any factor pushing your body toward excess mucus production will hit harder and last longer in an older adult. That is not a lament about aging. It is simply the physiology, and understanding it is the foundation of everything we are going to discuss today. So, with that foundation established, here are the 5 causes. Listen carefully, because I will be identifying which ones tend to compound each other. The first cause is one I want you to pay very close attention to, because research consistently shows it is the most frequently overlooked explanation for persistent throat mucus in this age group. It is called laryngopharyngeal reflux. You may never have encountered that term. Let me explain it in direct language. Most people are familiar with heartburn, that burning sensation in the chest after a heavy meal. But there is a quieter, more deceptive version of this problem, one that presents with no chest burning, no obvious digestive discomfort whatsoever, just a throat that will not settle. Here is what happens. At the junction where your esophagus meets your stomach, there is a muscular ring called a valve. Its sole job is to remain closed after you eat, keeping stomach acid contained where it belongs. As we age, this valve can gradually lose its tone, much like a rubber band stretched too many times over too many years. And when that valve fails to close completely, stomach acid travels upward, not just into the esophagus, but all the way into the throat, the voice box, and sometimes even the nasal passages. Here is the biological detail that makes this so consequential. The tissues of your throat are not equipped to handle acid the way your esophagus is. Even the smallest trace of acid reaching your throat triggers an immediate protective response. Your body rushes to produce thick mucus to coat and shield that irritated tissue. This is sound, logical biology. But when this is happening night after night while you sleep, you wake up every single morning to that familiar heaviness at the back of your throat with no clear understanding of why. Because there is no heartburn, no chest pain, nothing pointing toward your stomach. Research published in clinical ENT literature shows that up to half of people with this condition report no heartburn at all, just chronic throat clearing, a rough voice in the mornings, and mucus accumulating the moment they open their eyes. Ask yourself honestly, is your throat significantly worse in the morning than later in the day? Does it worsen when you bend forward? Has your voice sounded rough when you first wake up? These are the fingerprints of silent reflux. When I get to the action plan, I will give you specific steps that can begin making a real difference tonight. One additional detail worth your attention. If you regularly take anti-inflammatory medications for joint pain, ibuprofen or naproxen for example, peer-reviewed research has established that this class of medications reduces the body's natural protection of the stomach lining. That makes acid reflux, including the silent variety, significantly more likely to worsen. If you take these medications regularly and your throat has been persistently irritated, bring that connection up specifically with your doctor. Before we continue, take a moment and tell me your name and where you are tuning in from. I go through the comments, and I genuinely want to know who I am speaking to today. The second cause is one that tends to arrive quietly and go unnoticed for exactly that reason. When people think of sinus problems, they picture the dramatic version: intense facial pressure, a throbbing forehead, a nose completely blocked. But in many adults over 55, chronic sinus inflammation presents almost invisibly. Breathing feels mostly normal, no significant headache, no dramatic announcement, and yet the sinuses, mildly swollen and producing slightly more mucus than normal, are draining steadily and silently down the back of the throat all day long. This is called postnasal drip, and a 2024 study confirmed that the average age of patients presenting with it is exactly 55. That is not a coincidence. Here is the frustrating part. Many people dealing with this have been taking antihistamines for months, assuming it must be seasonal allergies. Antihistamines dry the mucus temporarily, but they do nothing for the underlying inflammation inside the sinuses that is driving the excess production. And dried, thickened mucus stuck at the back of your throat is frequently more uncomfortable than the original problem. The approach with the most consistent research support is straightforward and affordable. Regular nasal rinsing using a warm saline solution. A 2025 clinical review published in the journal Medicina concluded that nasal irrigation is an effective, safe, and low-cost strategy for treating and preventing upper respiratory tract diseases, widely endorsed by ENT specialists internationally. High-volume saline rinses physically remove inflammatory mucus, reduce mucosal swelling, and improve the natural ciliary clearance function we discussed, the very system that declines with age. The single most important word in all of that is consistency. 1 or 2 uses gives you 1 or 2 days of mild relief. Daily practice produces cumulative, meaningful improvement. I will walk you through the exact method in the action plan. If you are still here and finding this useful, type the number 2 in the comments. And if you have not yet subscribed, do it now. 'Cause number 3 is where I see the most genuine surprise in people's expressions when I raise it. Because when patients come in and we begin working through what might be behind their throat symptoms, their medications, the ones they have been taking faithfully for months or even years, are simply not something they think to question. There is a class of blood pressure medications called ACE inhibitors, angiotensin-converting enzyme inhibitors. They are prescribed millions of times every year. Effective, well-tolerated in most respects, serving a genuinely important purpose. But they carry a recognized class-wide side effect the research documents clearly. They allow a substance called bradykinin to accumulate in the body. And in a significant proportion of users, studies report between 5 and 20%. That accumulation triggers persistent throat irritation and a relentless urge to clear the throat. Critically, this is not an allergy. It is simply how the drug works, and your throat is sensitive to that effect. Here is the detail that causes this connection to be missed so often. Oh, the side effect can take weeks or even months to develop after starting the medication. So if you began a blood pressure pill 8 months ago and your throat started bothering you 6 months ago, you may never have drawn a line connecting those two events. But that exact timing alignment is precisely what the research describes. A large-scale study of more than 27,000 patients found that adults over 65 had a 53% higher likelihood of experiencing this throat side effect compared to younger users. This is directly relevant to this audience. If you take a blood pressure medication and are unsure whether it belongs to this class, your pharmacist can tell you in under a minute. And if it does, there are alternative medication categories, ARBs, angiotensin receptor blockers, that control blood pressure equally well without this specific side effect. That conversation with your prescribing physician is worth having, and you are entitled to have it. If you are still watching, type the word clarity in the comments, because that is precisely what I want this discussion to deliver. The fourth cause surprises people not because it is complex, but because it is something they have long dismissed as too straightforward to matter: hydration. But let me give you the physiology, because this is not the simple reminder to drink more water you have heard 100 times. Your mucus is mostly water. Its consistency, whether thin and fluid or thick and sticky and difficult to move, is directly determined by how well hydrated the surrounding tissue is. Think of maple syrup fresh from the bottle versus maple syrup that has been sitting open overnight. Same substance, completely different behavior. Your mucus works in exactly the same way. Here is the aging-specific detail that elevates this beyond a simple reminder. Research has established clearly that the thirst mechanism becomes significantly less reliable as we get older. A younger adult feels thirsty well before becoming meaningfully dehydrated. In older adults, that early warning system is dulled. You can be dehydrated enough to noticeably affect your mucus consistency and daily comfort without feeling particularly thirsty at all. Waiting for thirst to prompt you means you are chronically operating behind the curve. And a mildly dehydrated state maintained day after day keeps your mucus persistently thick in ways that amplify every other cause we have discussed. A practical fluid target referenced widely in clinical nutrition guidance is approximately 30 milliliters per kilogram of body weight per day from all sources: water, herbal teas, soups, water-rich foods. The behavioral key is deliberate, distributed intake throughout the day, not catching up reactively when thirst finally arrives. If this is landing, type the number 4 in the comments and hit that subscribe button and the bell icon so you do not miss what is coming. The fifth cause is one rarely addressed in conversations like this one, and I think that is a meaningful failure. Because for a substantial proportion of older adults dealing with persistent throat mucus, the root of the problem is not in the throat, not in the sinuses, and not in the stomach. It is in the gut. Here is what the research shows. Your digestive tract and your respiratory system share regulatory pathways through the immune system and the nervous system. The health of your gut microbiome, the trillions of bacteria living in your intestines, directly influences how reactive and how inflamed your upper airways are. When the balance of the gut microbiome is disrupted, a state researchers call dysbiosis, it can activate immune responses that promote mucus overproduction in the airways. Not because anything is physically wrong with your throat, but because the gut is sending inflammatory signals the respiratory system responds to. This connection, sometimes called the gut-lung axis, is an active and rapidly growing area of clinical research. Multiple peer-reviewed studies, including research published in the American Journal of Respiratory and Critical Care Medicine and the Journal of Allergy and Clinical Immunology, have confirmed that gut microbiome disruption can trigger immune responses that fuel airway inflammation. Animal model studies have gone further. When mice received gut microbiome transplants from patients with chronic lung disease, those mice showed measurably increased airway mucus production, demonstrating a direct causal link between gut health and what happens in your airways. What disrupts the gut microbiome in older adults? A diet low in fiber and fermented foods, repeated courses of antibiotics over the years, high sugar intake, chronic stress. These are not exotic factors. They describe the daily reality of a very large proportion of older adults. You will not resolve a gut-airway axis problem with a throat lozenge, but you can begin supporting your microbiome through consistent, intentional daily choices, and I will include specific guidance in the action plan. Before I lay out the full plan, I need to pause on something genuinely important. Most of the time, persistent throat mucus in older adults is benign. It is exactly what we have been examining today: manageable, addressable, and not dangerous. But your body sometimes uses symptoms to flag something requiring professional attention rather than self-management. Please see your doctor promptly if you notice any of the following: mucus consistently tinged with blood, even a small amount; difficulty swallowing that is gradually getting worse; unexplained weight loss alongside your throat symptoms; a lump or persistent swelling in your neck; or a significant voice change that is not improving with time. These signs go beyond today's conversation. Do not work around them. Bring them to your physician. Now, the action plan. This is where everything we have covered becomes something you can actually do. Tonight, stop eating at least 3 full hours before you lie down. When you eat and immediately recline, your stomach is still processing, and the valve we discussed has its hardest time staying closed. 3 hours of upright time after your last meal is one of the most evidence-supported behavioral steps for reducing nighttime silent reflux. Also, elevate the head of your bed, not with extra pillows under your head, which only bends your neck. Use a firm wedge placed under the headboard legs or under the mattress. Even a few centimeters of incline uses gravity to your advantage and meaningfully reduces acid reaching your throat while you sleep. Before bed, drink a full glass of warm water. This supports overnight hydration and keeps your mucus thinner, so morning accumulation is less severe. Tomorrow morning, before coffee and before breakfast, drink 1 to 2 glasses of plain warm water. This single habit costs nothing. It immediately begins rehydrating your system and loosening overnight mucus accumulation before it has a chance to define your entire morning. It is one of the most consistently impactful changes people make. This week, get a nasal rinsing device from your pharmacy, a neti pot or squeeze-style bottle. Use water that has been boiled and cooled to a comfortable warm temperature, not straight tap water. Add a small pinch of plain salt and optionally a very small pinch of bicarbonate of soda, which may help thin mucus by gently neutralizing nasal acidity. Use it once daily, preferably in the morning. Give it 2 full weeks of consistent practice before assessing whether it is helping. Consistency is what separates the people who say it worked from those who say it did not. Make an appointment to review your medication list in relation to your throat symptoms. Come with a written timeline. When did your symptoms begin? And when did you last start or change a medication? If you take a blood pressure medication, ask directly whether it is an ACE inhibitor and whether an ARB alternative might be appropriate. Do not hesitate to have that conversation. To support your gut-airway connection, add 1 small daily serving of a fermented food, plain yogurt with live cultures, kefir, or a small portion of kimchi or sauerkraut. These choices begin to diversify and strengthen the gut microbiome in ways research links to reduced airway inflammation over time. This is a long-game strategy, not an overnight fix. But long-game strategies are the ones that actually shift your baseline. Set hydration reminders. Keep water accessible throughout your home and eat more water-rich whole foods. Cucumbers, watermelon, soups, herbal teas. Your body will reflect that investment within days. A word on popular home remedies, because I know you have tried some of them. Honey is genuinely soothing for irritated throat tissue. It is not harmful and can calm symptoms temporarily, but it does not address any of the 5 causes we examined today. Dairy does not create mucus from nothing. The science does not support that claim. But some individuals find that dairy proteins create a sensation of increased thickness in existing mucus. If you notice a consistent pattern, a 2 to 3 week reduction trial is worth attempting. Apple cider vinegar is frequently suggested online, but for anyone dealing with silent reflux, Introducing additional acid can actually aggravate the problem. Proceed with caution there. Here is what I want you to carry away from this conversation. That persistent mucus at the back of your throat has a reason. 5 possible reasons, and most people living with this problem have never had a single one of them properly explained. Silent reflux occurring quietly during sleep with no heartburn to warn you. Postnasal drip from low-level chronic sinus inflammation that never announces itself. Medication-related throat irritation from ACE inhibitors, developing months after starting the drug and never getting connected. Chronic mild dehydration running just below the threshold that triggers obvious thirst. And gut microbiome disruption sending inflammatory signals your airways are actively responding to. None of these require you to simply accept a life of constant throat clearing. Each one has a practical, evidence-grounded response, and none of the first steps require a prescription or a specialist referral. They require knowledge, consistency, and the discipline to treat your symptoms as a signal worth addressing rather than a nuisance to endure. If someone has ever told you this is just part of getting older, I hope today gave you a fundamentally different perspective, because you are not simply aging. You are dealing with specific, identifiable, addressable physiology, and you deserve to understand that with clarity. Make sure you are subscribed and have notifications enabled. I have a video coming very soon on how gut health connects to the chronic inflammation patterns driving some of the most common complaints I hear from adults in this age group. That is a conversation worth showing up for. If this video gave you something genuinely useful, consider sharing it with one person who has been quietly managing this same problem. That one share costs you nothing and could meaningfully change how they understand what their body is communicating. Tell me in the comments which of these 5 causes surprised you the most and how long you have been dealing with this. I read every comment. This is a real conversation, and your experience matters here. Take care of yourself. Stay disciplined, and I will see you in the next one. Senior Wellness.